Gentlemen, thanks so much. Appreciate your time as always. Ben, first to you on the reopening. What do you make of where we're at as a nation? Because obviously Victoria now saying that eradication is not its plan as of today. Daniel Andrews and his advisors saying that's not going to be achievable. Basically on the same page as Gladys Berejiklian. Is it a nation divided, Ben?
Well, it's a Delta virus. It's very hard to get under control, isn't it? And you're starting to think that it's just too difficult to get under control. And getting it back to zero is very, very difficult. And ACT, a smaller number of cases, but again, they're on the rise too. So once it's in, it's very hard to get rid of. And that does lead to a divided nation. Those states that are COVID-free are going to want to stay COVID-free for a little while longer. Notwithstanding that, of course, in the end, we have to remove restrictions. But the race to get vaccinated is one thing, and I saw your figures just then, and of course, of the total population, the vaccination rate's lower. It's only 27% of the population that's fully vaxxed, and there's going to be more pressure to get more kids done, I think, from parents and everybody who doesn't want to see the virus spread. But then there's the rest of the equation, and that's our ability to contact trace, to test, to trace, to isolate and quarantine, the TTIQ, and our hospital system, and whether it's up to it, whether we've got enough ICU, we've got enough personnel to manage them. And the Doherty modelling says that at 80% vaccination rate, we're going to have 40,000 cases a day. And I don't think the community yet fully comprehends that, and they're going to be worried about that. And if it's all incumbent on our political leaders to have as much a debate about TTIQ and our hospitals' capability, as well as getting that vaccination rate up, we're going to have to do all those things together. And I don't think the debate is there at the moment.
David Gazar, we saw this polling in the Australian today, the YouGov polling, which had the lockdown survey, state borders to stay open once the vaccine rollout is complete. 62% support that. If vaccinated. Now, the lockdown survey, as it pertains to passports, like we've seen in France, 66% support in relation to that as well. The government has the majority on its side here, although that would differ according to the state-by-state breakdown, David.
Yeah, there's a different complexion to the acceptance of the states. And I mean, the one thing, going back to your previous question, that I don't quite understand is the states that now say they want to lock down have agreed at National Cabinet to open up. So I can never quite figure out why they would agree to it at National Cabinet before retreating back to taking a position. I understand the position. They want to keep COVID out. That's fair enough. But why agree to open up in the first place? The difficult thing for them, because I think we can see the politics of this shifting really, really quickly, is that they are going to have to say to the people in their states as Christmas approach and their businesses increasingly come under pressure if COVID does get in, we don't want to open up. And I don't think that's sustainable longer term. People there are going to want to travel interstate to see family at Christmas time and travel to go on holidays and so on and so forth. So it's clear from the direction the rest of the world is going, and from the ways that some of the states where Delta has got in, that have got higher vaccination rates, that at some point we're going to have to embrace reopening. Now, Ben is right to the extent, I think, that people have to come to grips with the fact that it's no longer going to be cases, it's going to be hospitalisations. Much in the same way we don't talk about the number of people who've got pneumonia on any particular day or the flu on any particular day. We're going to have to confront the idea of numbers in ICU and the death rate, which will fall dramatically the more and more people get vaccinated. Yeah. And I think that's the absolute key, is that people have got to get vaccinated and all this becomes easier.
And David, further to that point, before I go back to Ben on this, you look at the economic numbers, David, underpinning that is that health story about the vaccines. It has such an impact in terms of the health ramifications, the health system that we all use, but also the economic story. I know there's the argument that people, it shouldn't be mandatory. People get to decide But in a once-in-a-century pandemic, those freedoms are curtailed, surely, when it comes to various things like, flying and other things. Businesses should be well within their rights to mandate vaccinations for their workers and for those that use their services.
With freedoms come responsibility, as we know, Kieran, and people have got to think about their neighbours, their teammates, their co-workers, other diners in restaurants, other people wanting to go to a football game, other people wanting to go to a movie. So the whole notion that we've seen sort of exposed over the last 18 months is that people have tried to look at a public health crisis through an ideological lens. And as we know, the virus doesn't follow an ideological trend.
No. Then, Ben, I've got to say, apart from someone who medically cannot get it, the jab, this point that David makes, I think, is a compelling one, that with freedoms come responsibilities. And in this case, a once-in-a-century pandemic, the idea that you can say, oh, no, sorry, I have concerns about it, when the rest of the population depends upon us getting to a critical mass, that argument loses a lot of weight, doesn't it, Ben?
Yeah, absolutely. With freedom does come responsibility. People are going to have to get vaccinated if they want the same freedoms as other people. But with freedom does come responsibility, and there's responsibility on the government to ensure that everybody who needs to get vaccinated can get vaccinated. We've had this kind of blanket 80% figure. But of course, it depends upon particular communities also getting vaccinated. There's been some talk about the appalling rates of vaccination in our indigenous community, and it's a disgrace. We heard questions in question time today about pregnant women in Newcastle who couldn't get vaccinated, who want to. We know that socio-economically disadvantaged communities are less likely to be vaccinated. So there's a responsibility on policymakers and the government to ensure that the vaccination is spread evenly across the country. Yes, individuals are going to lose out if they don't take it willingly, but the government's got to do more to get everybody vaccinated. At the same time, make sure our state and government is strong enough to be providing those health services, those ICU beds, that contact testing and tracing. I can't say it enough. The Doherty modelling says that we need that operating effectively as well as the vaccination rate. So yes, there's responsibility on individuals, but boy, there's a responsibility on the government to make sure those other things go well and that vaccination gets to all people, Indigenous people, socio-economically disadvantaged, and that there are systems in place that allow people to take time off work to go and get vaccinated and recover if they're sick from the vaccination for a little while. All that will mean vaccination is higher.
The bottom 20% get nothing. They're really unfair tax cuts.
People want to see much stronger action from the government when it comes to climate change.
It's no coincidence that we have a wages crisis in Australia.
Transitioning to net zero emissions, it doesn't seem like there's much room for gas.